Hello, I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. Glad that you could join us. In this segment, going to have a conversation with Justin Williams, founder and CEO of Noteworth, joining us here on Health Professional Radio to talk about some of the biggest issues that are facing telehealth today, particularly in rural areas. He's also going to talk about how his team has launched a specific platform to solely monitor and screen COVID-19 and is currently tracking over 2,000 COVID patients. Welcome to Health Professional Radio, Justin Williams. Thank you for taking the time.
Thank you for having me.
Are you a healthcare expert? What is your background as it relates to healthcare?
Well, I think I come from a different place, actually. I'm prior military.
Okay. All right. Thank you for your service.
Well, yes. Came from actually the U.S. Submarine Force, so slightly different, given ending up in healthcare, and spent some time in big tech at Apple and with defense contractors, but had always been passionate about healthcare and figured I'd find a problem to apply my engineering skill set, surrounded myself with as many clinical experts as I could, and sort of off we went.
Of course, during this COVID-19 pandemic that we find ourselves currently dealing with, telehealth, telemedicine, video conferencing has exploded. I mean, exploded is probably an understatement of what has happened. What are some of the biggest challenges facing telehealth today, especially in some of the rural areas, where rural areas always seem to have a problem with internet or telephone or water or roads? Talk about some of the issues that we're facing now, in addition to just the pandemic itself.
Yeah, so I think, and I'm not the first to say this, COVID has laid bare a lot of the issues that we had, both as a country and as a health system. What the unique challenge is in the rural setting is the same that they've always been. It's distance, it's connectivity, it's access. Largely, rural areas are served by critical access hospitals who generally don't have an infrastructure to really support being able to treat patients with maybe the same level of care that if you're living in a city or things along those lines. And then when you take away that access based with lockdowns and clinics having to close due to exposure risk and having to change the way they treat patients, you forced patients who otherwise didn't have access into a scenario where there is not an option other than something like telemedicine. The great thing, or the silver lining with technology, is sort of as the great equalizer, or at least it aims to be in most cases, giving people access to information, sort of what the internet's done the best. Obviously, it's come with some drawbacks as well, but when you look at something like telemedicine, as long as a patient has access to the internet, they should be able to have access to care. Obviously, the access to the internet being the part that I think is the biggest challenge. So I can say, as a company like us, we've been really focused on making sure that we can deliver video conferencing and this level of care in sometimes cases where patients have nothing better than, say, a 3G network. I mean, most of us haven't even thought about that in the last few years. But there are a lot of advances. 5G, I think, is a great thing for the rural areas. Getting broadband level speed without the infrastructure needed is huge. And it is also giving us the ability to expand the level of care that companies like Noteworth are able to deliver.
You mentioned closing clinics due to the pandemic. As telehealth has exploded, and as you mentioned, forcing people into a position where there is no choice but to get care through telehealth, through 5G, do you think that some of these clinics that have closed and lost staff will find themselves without the need for staff, or do you find that telehealth can give access without staffing cuts?
So I think it's a little bit of both. I think you reimagine your staff. I think one of the things that we do in healthcare right now is we just still do a lot of manual processes, otherwise unacceptable in most industries. We're still pushing around a lot of paper. I guarantee everyone who's listening to this has handed out or filled out a clipboard with a pen on it here recently, and you wouldn't dare do that in any other place you visited, or at least spent your money as a conscious consumer. So if you take a look at some of those processes where technology can lean in, where telehealth can lean in, you remove a lot of that. So in our case, sort of the biggest thing that we preach or evangelize to our clients is, I want you as the clinician, you as the nurse, the PA, the DO, the MD, to operate at the top of your life. I don't want you chasing administrative things that you don't have to trace. The computer's really good at that. I don't want you to have to be stuck in ceremony in some cases. And it actually creates a really interesting scenario that a telemedicine encounter that would have been that same 15 minutes that you would have spent in an office is truly a 15-minute window where you're 100% engaged with your clinician, because they're not coming into a room, they're not washing their hands, they're not logging into a computer, they're not talking to you with their back to you as they're getting all their situations set, then spinning around and able to have a 9-minute conversation, and then spinning around and trying to finish up notes. In a telemedicine encounter, now they're able to be 100% focused on you. Granted, it's through the webcam, right? But they're able to be focused on you because that ceremony went away. And you can have the same meaningful interaction. Granted, again, they can't put their hands on you and things along those lines, but we do a ton of other technology that allows for as much of that similar level of care to be delivered. So if you think about where that takes the industry, if you take away some of that administrative side of things, you take away some of that ceremony, you can now have nurses that can deliver more time to patients and things like care management instead of, again, chasing paperwork, more time in the individual encounter, more personalized care. So that same staff is more efficient. That same staff can be more focused. And that same staff can do what they all went to school and train for all these years instead of sort of the other side that I know most of your listeners are not the most fond of.
Let's talk about this COVID-19 pandemic. Most states are saying, well, most experts are saying that testing and tracking are the keys to successful reopening when we reopen. You've launched a specific platform to monitor and screen COVID-19. You're currently tracking COVID-19 patients. Is that correct?
Yes. Yep.
Mm-hmm. What's the name of this platform? And let's talk about it and talk about its availability and how it's being used.
So the platform is called NoteWorth Connect, and you can only really get it if your doctor sort of sends it to you. So we're not an open platform like, say, a Fitbit application or anything along those lines. We're basically prescribed. So our clinicians, when they see a patient and they think they're potentially COVID positive or they have a test pending or whatever the case may be, potential exposure, even as a nurse or a physician who may have had an exposure through their profession, the way that the app works is that patients are able to be screened into the platform. They're able to track their symptoms, whether or not they're developing upper respiratory symptoms, whether or not they've developed any of those other systemic things like a fever, whatever the case may be, and be able to track those things, as well as even report their isolation or who they've been around through the platform, and create this sort of digital trail. We're not doing any of the pinging for your real-time information. We're doing it on patients, on patient merit, and allowing them to share that information with their clinicians. And whether at home and sick or recovering, they're able to use telemedicine and things like that to engage with their healthcare team and not feel disconnected. Right, you're not sick and stuck at home or sort of left alone. So if a patient's condition continues to improve, then they can transition back and continue to return to health. And if it doesn't, then you've got someone who can monitor that and get a patient to care far earlier than they may have shown up to the emergency room.
Right. Well, where can we go online and get some more information about NoteWorth and your platform?
So you can check us out at noteworth.com. You'll see things there. It explains the platform. You'll see the work that we're doing for COVID-19 and dozens and dozens and dozens of other conditions we help our clients with around the country, from chronic conditions to labor and delivery to mental health. We're able to help out our partners and our patients through all different aspects of care.
Justin, I appreciate you talking with us this evening here on Health Professional Radio.
I thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Justin Williams, founder and CEO of Noteworth. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.